Hello, good day, good day. It's the infectious doctor, Amina Goodwin Fernandez. Just doing a quick um, talk. Um, been busy the past week where I was on call, but I am back and I promised to do a quick little presentation on why exactly does social distancing work to control coronavirus disease. So, I think, a lot of people take it maybe lightly. Well, not a lot, but maybe too much. Take it lightly. So, just to give an idea of what it is about COVID-19 that makes it just kind of so cunning. A lot of infections, influenza and other infections, talking about the other SARS viruses, the first SARS-1 from back in 2002, and then MERS in 2013, and influenza and so on. A lot of these infections, when they infect you, they basically, you come down, you get ill quickly, right? So you're not walking around with infection, infecting other people. You get sick within 1 to 2 days, and so you're down in bed, or you need to be in the hospital, and so on and so forth. So you're not a risk to other people per se. Now, this coronavirus, COVID-19, this one is more sneaky, it's cunning. So it infects us, and it can take, well, average 5 days incubation period, so 5 days in your body before you start manifesting symptoms, but it can take up to 14 days incubating in your body before you actually have symptoms and realize you're sick. And then for a lot of that time, you can actually be spreading the infection to other people. In fact, it's even more cunning because a small percentage of people, maybe about 7-10% of people, are infected and actually never get any symptoms. So they never know they're infected. And so for all these days, somebody is going around mixing, with the public. And, if they happen to cough because you have a itch in your throat, or sneeze because something tickles the nose, and so you're getting out your secretions and infecting people who are within 6 feet vicinity of you. And so that's the cunning thing with this virus, where unlike others, where you get sick quickly and you're in bed, down, away from people, on your covers, this one, you're up and around, and then infecting people unknowingly. And so this thing about social distancing now is essentially to prevent people who are unknowingly infected from infecting a large group of people. So in the beginning, they talked about restricting groups to maybe 1,000, then it went to 500, 50, and now basically no congregation, no groups of people together. Because, before restrictions, so the one or two, if you have, maybe depending on what's going on in the area, you have 2 or 3 infected people in the population at a party or whatever with several thousand people, and it's an open area, so they're walking around and coughing intermittently or sneezing intermittently, and it's potentially infecting multiple people in this large group. And then these multiple people, now they got exposed, breathed in whatever, and then over a 14-day period, they the infection starts brewing, the virus kind of multiplying in their system, and then they eventually end up with symptoms and infect other people. So with these large groups, there was just kind of rampant exposure of multiple people and then escalating infection. And because one person can potentially infect 2 to 4 people, so if you have one infected person, he's at a party, he infects 2 to 4 others, depending on how much he was coughing, right? And then those persons go home to they say they're in 4 different homes, they infect maybe 2 to 4 people in their area, and it exponentially increases like that. And so we see exponential increase in infections in New York, well, in the country, but of course, the hotspots in New York, California, and so on, right? So limiting groups now from unlimited 100,000 whatever to 1,000 or 500. So you have 1 or 2 infected people in a group of 500, and so that's a much smaller number than 1,000. So they would potentially infect fewer people, and then you have kind of less spread in the community like that, right? So keeping the groups now, because there's spread throughout the entire United States. So no gathering, no congregating. So essentially, if somebody gets exposed, like for example, a healthcare worker, a worker who would be a high risk person gets infected, and they could potentially infect 1 or 2 people in their household. but then the people in their household are probably not going to infect anyone else because they're not going anywhere. Nobody's going anywhere. The country or the area is on lockdown, or there's minimal movement and contact between people. So that is why the social distancing helps, because you don't have, just kind of rampant mixing with people, and then these, asymptomatic people who can still infect, just continuing to infect the population. Now, somebody told me when I said I was going to talk about social distancing and how it works, they kind of said, well, remember to talk about the fact that even those of us who are going to work, we should engage in social distancing as well. And that is actually quite true. So, again, we are like healthcare workers, I have to say, because I'm one, we are probably among the highest risk people, because, people are coming to us sick, and, sometimes, you just never know when you can have an exposure. But then one of my colleagues maybe might have been exposed and I didn't know, and they're not manifesting symptoms. But then if I'm too close to them, and again, there's a tickle or whatever, an itch, and they happen to cough or whatever, and I'm close to them, then I can potentially get infected like that. And so, yes, social distancing, it really applies as much as possible at work as well. We shouldn't be all grouped up on each other, and, because we want to decrease the chance of getting infected. And the same, of course, we are, excuse me, keeping our areas clean as well, but social distancing everywhere. I went to collect something from a spa yesterday, and actually, it wasn't full. They were just, actually, there was no one there but the owner. And we made a point to not get close to each other. I was at least 6 feet away. I was behind the counter, and I did not lean on the counter. And, I took my package and so on. But then when I got in the car, I sanitized my hands. And so that's basically how we're doing it. Social distancing, not gathering. Now, the time period, why 14 days? Because potentially the virus is incubating for up to 14 days. And so by the end of a 14-day period, most people who are infected are going to kind of declare themselves, and then they have symptoms. And because they know they're infected, hopefully, or know they have symptoms, because now we know that if you have respiratory symptoms, you probably should just stay put. Everybody, or most people, probably have that idea. So after 14 days, whoever has incubated and now they're going to get symptoms, and so they know, okay, we're going to stay put. Now, some places, I think China did it. They are even more draconian, where they extended the curfew or the lockdown for an extra 2 weeks. So that's like a whole 1 month lockdown, because you're counting for the first 14 days where it's incubating, right? Where it's kind of bringing you before you have symptoms. And then for those who will take, the incubation period is up to 14 days, and now they have symptoms. And so now there's an extra 2 weeks for now all the symptoms to resolve, and for all the infection to go away. And, everything is fine potentially. This virus, or viruses in general, actually cannot survive without the human host. And so if there's no further spread, like if I get infection, I'm self-quarantined, I'm quarantined at home, and then I get better, and I didn't give anybody the infection because I didn't go anywhere. I didn't keep in close contact with anybody. And so the virus just dies because my immune system cleared it and it's gone. It didn't get to spread to somebody else to propagate. So that's the whole idea behind social distancing. You account for the silent incubation period, right? So 14 days. And then if there's an extra 14 days added on, in case it's just massive, it's just a bad, outbreak in whichever area you are, and the community just really wants to get this thing under control once and for all, then they extend it. Of course, all of us want to get on with our lives, and we're hoping that maybe a 2-week period would really slow the spread, kind of really slow it, so that you don't have one person infecting 2 to 4 people, and then maybe afterwards it would just be kind of minimal, one here, one there. That's what we're all hoping. So that's social distancing. And let me see. Somebody told me I should try to see if people have questions to answer them, but I still cannot figure out how to do that. So again, if there are any questions, just put them in the box underneath, and I will address them. The next time I kind of appear on this live feed, I'm going to talk about what to do if you think you got exposed to COVID-19. Okay, oh my, like this person was coughing. I think they had COVID-19. Like, oh my, what should I do at home? So I'll talk about that. And just to remind you all that I don't give medical advice, I just kind of give general information. And if you want specific advice about yourself for your specific situation, you should ask your healthcare provider. Oh, Jason said less test, but yeah. Oh, yeah. I just can't figure out how to see all the whole line of comments. So yes, Jason, I can't. Oh, well, maybe Jason put something. Maybe nobody else put any questions. But don't worry, I'll address them after. So you all stay safe. Don't go out and about. Oh, Jason's question is virus in sweat of an infected person? So this is a respiratory virus. So basically it's in the nasal passages, the back of the nose and the back of the throat, and then it can be down in the airways and down into the lungs. So it's a respiratory virus. Not felt to be sweat, skin. They have found virus in the blood of infected persons, but it's not really felt that that's a strong mode of transmission. Also, it's been found in stool as well, but it's not clear how infectious virus in these other parts are. If you touch like a place with the virus, it's not going to infect you through your skin because it needs these moist, we call them mucous membranes. So the nasal passages and the mouth and so on and the eyes. So if the virus gets on these moist membranes, we call mucous membranes, that is how you're going to get infected. But just on your skin, you touch something, it's not going to affect you like that. But the reason why we talk about hand hygiene, washing hands using alcohol sanitizer, is because you want to kill any virus on your hands before you touch your eye accidentally or your nose or your mouth. So it's not that we feel like, oh, I'm going to get it because I touched myself. Oh, somebody bumped me, they touched me, whatever. We're not going to get it from just, the virus coming into contact with our skin. But it's if we rub our eyes or our nose with contaminated skin, then is when we have to worry about getting infected. So that's that question, and that's probably the only question. So if there are no other questions, I am going to exit and tomorrow talk about, if not tomorrow, Friday, sorry, talk about what to do if, oh, I got exposed. What am I supposed to do? All right. Well, thank you all for watching. And thanks for subscribing to this page and also for sharing with your friends if you find this useful. Stay safe, stay protected, and talk to you all another time. Bye.